So thank you very much. And let's move to questions. Let me go ahead and go to Gil first.
I want to thank you for another great panel. I have two questions. I guess one is sort of the big picture one, and one is a little bit more micro. So the first question is, if we want to think about leading health indicators and we are concerned about thinking about inequalities in that context, it kind of struck me, this panel really focused on race and ethnicity. Other panels focused more on geography. And, there are other types of inequality, like through sexual minorities, et cetera, that we haven't really considered. So, the big picture question then is, how do we think about all these inequalities in the context of a small set of parsimonious measures, especially when you think that probably for everything we can think of, there's going to be some kind of inequality on some kind of dimension. So just love to get your thoughts on that big picture question. And then the more micro question is, Brian, when you were presenting the results about self-rated health and you were showing that Latinos were kind of worse off, it made me think that, there's a pretty decent literature saying that for self-rated health in particular, for Latino populations, there's bias that should be corrected through immigration-related covariates. And so that leads to a more general question about, to what extent do we really need to adjust all these indicators for various things, especially when we believe that they're not, there's a dimension of bias that we need to think about. Thanks.
Sarah, did you want to start?
Sure. I mean, our mission is advancing racial and economic equity. So that's where we come from. But also, I think that race is the most critical of the, among equity issues. I think that race is really most fundamental and critical for us to address as a nation. And one reason why is we are becoming a majority people of color country, and we still have these massive inequities by race, which persist when you control for other demographics such as education. And so I think that fundamentally it is the critical thing to disaggregate by, but I think also you need to look at intersectional issues like income and gender. So hence my recommendations there. But I think that to achieve equity overall in this nation, we have to address racial inequities, and we won't get there without addressing that. And so that's where I would start.
That's great, Sarah. I totally agree with everything that Sarah just said. And like PolicyLink, my organization is focused on race and ethnicity. In fact, part of our mission statement is that we are attempting to undo the health consequences of racism. So we come through that lens. But it's my hope that we will get to a point where we're able to disaggregate data across the many fault lines of different populations that face inequities, whether it's according to ability status, sexual orientation. There's so many fault lines that we've got to adequately capture. The issue of nativity is so critically important to fully understand the tremendous diversity within some of the populations that we're not quite capturing. So I hope that we get to a point where we're able to, within the Latinx population, look at and disaggregate data by nativity status and geography and gender and any other factors that are relevant, and let the literature guide those questions. And then Gilbert, you had another part to your question, which I'm forgetting. I'm sorry.
It's about whether we should present essentially raw, unadjusted rates versus rates adjusted for various things.
Yeah. We did not attempt to adjust our data. I do hope that as we get more sophisticated about data collection and understand, for example, the impact of nativity on any given indicator, that if we're able to disaggregate those data, then that would at least help us account for some of those differences so that we're not attempting to adjust for factors where we may not have a sense of the degree of adjustment necessary. But that's an excellent point and points again to some of the data limitations that we've been wrestling with.
Does your question build on this one, or is it a separate question? Because I have a question that builds on this a little bit. Let me go first, and then I'll go to you. I understand particularly Sarah on the phone, the importance of race and economics. But let's step back from the mission that you have as an organization and the attention that's drawn to that, and ask the question about where the major distribution of inequities along the many dimensions that Gil mentioned, and perhaps also including education. If you were just lay out your measure of concern and sort of try to quantify the population impact of picking out a variable on which to focus as far as closing a gap, what would the data say to you? Do we really know that? Is it vary by whatever you happen to pick? You have picked a certain set of things. I mean, what do we really know about that?
So I'm going to interpret the question as, do we fully understand the depth of inequity across the many different dimensions or fault lines, I'll call them?
I wished I'd ask it that way.
Okay. And I don't think we know the answer to the question, but what Sarah said is so important when we think about the history of the United States and what we have wrestled with as a nation politically. Race is front and center. And so I take my own organization and mission out of that context and offering that because we have wrestled with race and racism for 400 years, if we solved that, that to me would be a strong indication that we are beginning to collectively think about inequity in its many forms, because this is the deepest and oldest fault line in my view. So
again, taking the model that you've laid out for hope.
Yes.
If we report the performance of a population group,
Right.
either an average or a median or a mean or whatever is the appropriate thing to say, you've really pointed out to us that there's really a distributional aspect to any data point in a population that's important.
Yes.
Should we take this opportunity to recommend that sort of process to a group like Healthy People 2030 for the purpose of establishing a norm in reporting that not only, reports the average or the median or the mean, but also the distribution by whatever critical characteristics they are, race, education, income,
Yep.
or all of those? I mean, because it seems like there's an opportunity there to,
right.
beyond your project or beyond Sarah's emphasis, to really establish some sort of different way of thinking about performance. Sure. That captures that sort of in a systematic way, say by all 300 variables or 1,200 variables or whatever is appropriate. Does that make sense to you or not?
It totally makes sense to me. I think part of our challenge is that we're recognizing that there are different audiences with extremely varying levels of sophistication, so we would have to be real clear about what that distribution meant. There are some data and measurement limitations that may contribute to it. There may be some true population differences that we're trying to get at. I think it's important. I think being as transparent as we can about the data is important, but I think I heard earlier conversation about the need, the responsibility really, if we're going to put that data out there, to be prepared to better educate the consumers, the end users, and in our work, obviously, frankly, the research and scientific community is but one audience, and it's not the major audience that we're trying to reach.
Sure.
So that kind of is my question. So from a messaging standpoint, if the reference group are the average of the 5 healthiest states with people with the highest level of education and income, does that translate to, for some people, a solution that's sort of bootstrappy? Well, go out and get an education and some income and you'll be healthy. And if it does, is there a danger in terms of translating that into a leading health indicator where potentially a large set of users could devolve, in my opinion, to an individual level responsibility argument versus a structural argument around investments in education or living wage jobs?
Yep. That's absolutely right. And so we have a responsibility to try to, again, shape the message and help people to understand the data. We're focused, our measures are largely focused on attributes of communities, and in this case, attributes of states that we think are amenable to policy change. So we very much don't want to leave people with a message that you got to get a college degree in order to be healthy. What we do want to suggest is that the conditions for health and well-being for folk with a college degree are such that we ought to replicate that for every population to the extent we can. And so that's the message that we're trying to lead with. But I appreciate that unless we message that clearly, there will be folk who misinterpret and engage in the kind of victim blaming exercise that we typically see. We're trying to focus people on the structures and systems that create opportunities for health and well-being in the first place. So we want to have on our soon-to-be launched website, accompanying the data, really rich explanations of how we got here, and also some strong, promising policy strategies that are, again, focused on structures and systems.
Could I, so because income and education also co-vary with socially defined race, then is it also maybe euphemistic to try to say that we're not really still using highly educated white people as the reference group, or did I miss something?
Well, and of course, as we know, this population, those in the benchmark reference population, these are folk from every racial and ethnic background. They just happen to be folks with college degrees or the highest incomes. In our measure, it was 400% of the federal poverty level or higher. So, the way I would message that is that there are people from all racial ethnic backgrounds in all in places around the country, but we know that there are some states that have conditions for health that are particularly important, and we ought to extend those same conditions for health and well-being for every population in every state.
Go ahead, Jonathan. This is a great discussion. Thank you, and thank you, Sarah. I'm trying to think of the practical parts of measuring, of trying to define a measurement ahead of time before we know what happens with regard to equity and recognizing the distinction between equity and disparities. But if a measure such as the difference between Black life expectancy and white non-Hispanic life expectancy had been chosen, which would have been a perfectly reasonable measure, I think, of equity, perhaps 10 years ago, we would have found improvement in equity, in part because of improvements in Black life expectancy, but also because of a decline in white life expectancy. And I think Sarah addressed that issue before, where she said, well, it's not really equitable unless everybody gains. But practically, how do we measure something? Or do you have any recommendations for sort of ways of coming up with measurements that might avoid the, well, the bad news is, but the good news is that we're reducing equity. I mean, that we're improving equity. So I'd just be interested in your thoughts on that.
Sure. Sarah, do you want to start on that?
Well, it just, I don't know the technical, I don't know of technically one number that captures that, but I know that you could decompose it, right? So you would look at, just decompose the trends and look by race at, well, is life expectancy increasing for all groups, or is it just decreased? Is it only increasing for some groups, right? Like you could be, you would have the data behind the metric, whatever it is, to look at what is contributing to that. That would be my recommendation.
And not just have an equity measure, but just say, well, we need to measure progress across a variety of different groups. And I'm actually, that makes sense. Yeah.
Seems to me that's why both of those variables interact with one another, the absolute performance with the disparity. And, the example you gave of the state that has the low disparity yet very low performance, it would be very appropriate in my view to characterize it routinely for anything you're measuring both ways, so you have to deal with the tension between those. I don't know. I don't know if I'm saying that.
And so we're able to estimate both the number as well as the share of the population whose health or conditions for health would need to improve, in our case, to meet benchmarks, using both absolute and relative measure. Sarah, you
go ahead, Sarah.
I was just concurring with you. We are in the process of creating an index to help people make sense of multiple indicators in the National Equity Atlas. And it's an index that has two rates, one for the relative value and then, or the absolute value in terms of an indicator and one for the disparity. Yeah, we couldn't figure out a way to do it just with one.
You want to jump in, Jude?
Actually, Shoma has a comment.
I am going to go to public comment right now, actually, and she would be in the public at this point. So I'm going to do that, and unless you want to make another point relevant here, and then I want you to sit right there because we've got a few more minutes. We'll pepper you with some more questions, maybe.
Okay.
But go ahead.
I basically just wanted to sort of give attention back to the brief that we have on health equity, and we realize that this area is ripe for both development and research in many, many ways. So we really appreciate the work that's ongoing and the learnings that are coming from the ground up, so to speak. And also, we highlight in this brief that we really need enhanced surveillance from a national point of view in getting to the more descriptive aspects of population broadly. We talked about gender, we talked about sexual orientation as examples. And so within that, also then linking back to the upstream actions. And I think that those policies from a national point of view are ones that we want to reflect down onto the measures that are being developed at the community and state levels.
Thank you for that reminder of the policy brief and the comments there. What I want to do is take Darcy has a comment that she made earlier, and I'm going to ask Alina to represent that. Then I'm going to ask for public comment for those of you in the room who want to make a comment, and that's when you could make a comment if you chose. And then I want you to sit right there. If I have more time, we'll go to more questions. Okay.
So this is a comment from our committee member who is watching the webcast. In my experience as chief epidemiologist at the Baltimore City Health Department, members of the public find life expectancy difficult to understand. This is to the earlier point about communication and audiences. I once had someone call to say he thought our agency had made an error calculating life expectancy for his neighborhood. Life expectancy had improved in his neighborhood, but he said he hadn't noticed any changes. People were still dying of overdose, heart disease, cancer, etc. I had to explain that there had been changes, but they were not super noticeable. Fewer infant deaths, fewer injury deaths among young people that had improved life expectancy in his neighborhood. He told me he thought our agency was cooking the books.
Cooking the books. So let me go to public comment here at this point. And at this point, I would invite anybody in the room who chooses to make a comment to come to the microphone. If you don't have a comment, I'm going to go back to questions. So go ahead.
We spent a lot of time thinking about the equity piece since it's one of our three major parts of our core measures in the well-being in the nation piece. And I think what we realized was as we looked at the data, you actually can't disaggregate race and not include it because it was a multiplier for everything else. I mean, when you really look at the data beyond where maternal mortality is worse for college-educated Black mothers than for middle school-educated white mothers, I mean, it's really becomes stark and obvious. And so that I think the idea of doing the two together made sense. The one measure that we thought was really intriguing to think about was actually a flip to Brian's point of shifting it to opportunity, was around taking years of potential life lost and thinking about per group, what is the opportunity for years of potential life gained, and seeing what progress was made based on that. And I just offer that as what came out as a fairly elegant solution that didn't require lots more data collection, but allowed us to actually see progress in each of those, as well as see that additively you would actually make progress as a whole. It took it away from a closing of disparities where some group had to lose in order for someone to gain that frame to what it looks like for everyone to begin to make progress.
Thank you. That's very helpful. For anybody else in the room that chooses to make a comment? I don't see anyone at the microphones unless you're going there. Okay. Did you want to make one?
Yeah, just a brief one. It's been mentioned a couple of times, but I just wanted to...
You might identify yourself
Oh, I'm sorry.
for the record.
I'm Wayne Jonas from the Sandy Riley Foundation. That one. Wayne Jonas from Samuel L. Foundation. One of the things that has been mentioned a couple times, but I haven't actually seen tools to make it happen. It was mentioned actually by Dawn Wright at the beginning, which is how do we link this incredible data collection, which is at a macro through macro scopes and other lenses, to day-to-day healthcare delivery practices. And I just think that is going to be an important aspect if we're going to get the healthcare delivery system on board with creating health in the country. So I just wanted to make that.
Yeah, very well. Thank you very much. Not seeing, do we have any electronic input by any means? Okay. So returning to this panel, additional questions for this group. So Brian, your conversation focused on goal, as well featured some comments about goal settings and distance to goals, as well as conversation about the impacts of potentially performance across the population.
Yes.
As I understand our task, setting goals for the leading health indicators or benchmarks is not part of it. I mean, it's selecting the indicators. Is that kind of analysis, in your judgment, an indicator in addition to the topic area that you're talking about, say, 300,000 more people who are, more babies that are living healthy lives or whatever it is. So in addition to the babies living, whatever it is the intervention is the distance to the goal itself in your mind an indicator? Or is that a separate part of the process?
Oh, that's a great question, and that would have been a perfect question for Steve Wolf, because the work on a population attributable risk is really just a way to communicate on any given indicator to a broader audience, and using social math to help people understand that. So I don't know that it's an indicator in itself. It's a process. It's a way of doing the work that hopefully allows us to communicate more broadly to a range of audiences.
We've had other comments made on communication, which again is not part of our charge, but is good advice for the larger effort. So appreciate that comment. Martha?
I'm thinking about some of the comments that were made earlier about sort of place equity and sort of policies that promote equity. And I just wonder if people in this room might give some suggestions about place, what those policies, I mean, there's sort of improvements in minimum wage that sort of come to mind, but if there are sort of evidence-based policies that are known to improve equity that we could sort of put some force behind, it would be helpful to raise them at this point. And I look to you, I know maybe Bobby, I think, brought some of that up, and others in this room, so.
I'd be happy to start, and I'm sure there's a lot of expertise on this issue in the room. We generally call for two general buckets of policy strategies to be implemented simultaneously. One are place-based investments such as opportunity zones, any number of strategies that increase economic activity and bring health-enhancing amenities to communities while at the same time reducing the concentration of health risks. Food is a great example. So fresh food financing initiatives have popped up all over a number of states. And of course, we have the National Fresh Food Financing Initiative that provides economic incentives and tax incentives to specific places where we need healthy food retail. But if I could, to me, one of the most important and often overlooked interventions, if we're talking about place, is the potential of housing choice to be a better part of our public health arsenal. We know that when kids are growing up in high poverty neighborhoods, overwhelmingly these are kids of color facing an array of environmental assaults, lack of access to high quality schools, overrun with unhealthy food retail, environmental health risks. If we can help them using existing programs like housing vouchers to move to lower poverty neighborhoods, as Raj Chetty and his colleagues found.
Can I just clarify, because I think I didn't ask the question the way I actually wanted to ask it,
sure.
Which is, from a practical point of view, if you were to create an objective for policies, would that involve, looking at national levels in a way that you could see what percentage of, I'm just trying to think about how you would actually actionalize an objective that looked at policies that improved equity. And I wonder what ideas people have for that.
Yeah, so to make my long answer short, I would say that in the HOPE measures, for example, we have a goal of having almost all families have access to low poverty neighborhoods with fewer than 20% of the population at the census tract level below poverty. It's such a major structural driver of particularly racial inequities in health, wealth, education, criminal justice involvement. So to me, that would be an important community level indicator that will tell us if we're truly tackling our deepest structural inequities.
We're going to have to wrap up because of the time. Sarah? Sarah, go ahead.
I would recommend for a policy framework that gets down to the local level in terms of policies. We have an All in Cities policy toolkit. If you just go to allincities.org, and there's a toolkit, and there are 6 categories of policies that include many recommendations and examples.
Thank you, Sarah.
Thank you.
Appreciate that, and glad you interrupted me when I tried to move on too quickly there. So
No, I'm sorry.
No, that's great. That's great. Absolutely great. So this has been, I want to first thank this panel, Dushanka and Brian and Sarah. They're terrific. And Nico, now flying his way back home, I'm sure. So at this point, this has been a very rich day, very concentrated and very important opportunity for us to hear in this public forum many of the thoughts of these experts on this task before us. So I want to again thank everybody who prepared for presentation today. For the panel facilitators. I want to particularly thank the staff, Alina, Carla, and whoever else I'm not, Anna, for really putting this together in a fashion that's been very, very helpful to our test. So thank you all for that. We will take all this input and do something with it, I'm sure. And anything that we've said today should not be interpreted as an opinion or a direction. I'll just reiterate that. But in the course of this day, it's been a very rich conversation. So if you have any additional comments or questions for the committee, please communicate with Alina Batchu here. I know several people have made remarks to me about ideas or frameworks or things they might like us to take a look at. Please send them to us. We are open to looking at that and can look at all that. It's public. It'll be publicly available information, but anybody who chooses to do that, we will consider whatever is sent in to us as we would normally do. So thank you for doing that. Any material you do send will be made public through the public access file. And that is because the National Academies comply with Section 15 of the Federal Advisory Committee Act rules. And so that's for the lawyers. So we're going to comply with that. So with that, thank the committee, and we're now adjourned.
Thank you.